There is a new medication coming down the pipeline that is set to completely revolutionize how we treat erectile dysfunction. We are talking about a compound designed to improve erection quality, penile rigidity, and the overall capability for penetration. But the most exciting part is the promise attached to it. Data suggests it could be significantly better than Tadalafil, which you likely know as Cialis, and Sildenafil, the famous Viagra. If you have been waiting for the next generation of performance solutions, you need to pay attention to this. Stick with me until the end, because we are going to break down the science behind this new drug emerging in 2025, known as Sildenafil. So, let's get right into it. A lot of research is constantly being poured into improving erections. The truth is, we already have a series of treatments that are very effective. If you are watching this and you are struggling with the ability to penetrate, if you are dealing with weak erections, or if you find yourself losing your erection in the middle of the act, you are not alone. There are a series of causes for this, but the treatment landscape has historically been very linear and, for most men, highly successful. What we have available today already offers high success rates. However, getting the result you want requires guidance. It requires understanding the dose, the step-by-step application, and most importantly, the underlying causes. Whenever a man presents with erectile dysfunction, the first step shouldn't just be popping a pill, it should be a hormonal screening. One of the most common possible causes is a drop in testosterone levels. You might be loading up on Tadalafil or Sildenafil, thinking you have a plumbing problem, when in reality, your issue is hormonal. In that case, the solution isn't a vasodilator. It's hormonal replacement or stimulating your body to produce more testosterone, depending on your age and fertility goals. If the cause is hormonal, you have to track it and treat it specifically. Then there is the vascular factor. This is most common in men as they age, typically starting in the 40s, 50s, or 60s. Conditions like diabetes, smoking, and obesity accelerate this, but the simple fact of aging is an inherent risk factor. As we get older, our blood vessels naturally age. They become stiffer, rigid, and less elastic. This endothelial dysfunction means less blood arrives at the penis, and the erection quality degrades over time. This happens simply because we are getting older. And of course, we cannot ignore the psychogenic factor. Performance anxiety is a massive erection killer. When you are nervous about performing, your body releases adrenaline. Adrenaline is the enemy of an erection because it causes peripheral vasoconstriction. It literally pulls blood away from the penis to send it to your muscles for a fight or flight response. Understanding these three pillars, hormonal, vascular, and psychological, is crucial because you need to be treated as an individual. But assuming you have addressed those, or you need that extra mechanical assistance, we look to pharmaceuticals. And that brings us to the new player in the game, Sildenafil. This drug is currently in phase 3 clinical trials. For those who don't follow pharmaceutical development, phase 3 is the final hurdle before commercialization. It means the drug has passed safety tests and is now being tested on large groups to prove it works. A major study published recently in 2025 has put Sildenafil on the map. This was a massive undertaking, a multi-center, randomized, double-blind, placebo-controlled study. In the world of science, that is the gold standard. It means neither the doctors nor the patients knew who was taking the real drug and who was taking a sugar pill, which eliminates bias. They evaluated over 760 men for a period of 12 weeks. The results were compared against the placebo group, and the data is incredibly promising. The study utilized doses ranging from 2.5 milligrams up to 20 milligrams. Interestingly, the most commonly utilized dose was just 5 milligrams. What they found was that patients taking Sildenafil experienced a robust, vigorous improvement in erection quality. Now, let's talk about speed and potency, because this is where Sildenafil starts to distinguish itself from the old guard. The onset of action, how fast it kicks in, was recorded between 30 minutes and 4 hours. While 30 minutes is standard for many fast-acting ED meds, the robustness of the effect at such low doses is what catches the eye. Think about it. Viagra or Sildenafil typically requires doses of 25, 50, or even 100 milligrams to get the job done. Sildenafil is achieving these robust results with just 2.5 to 5 milligrams. This classifies it as a high-potency molecule. You need significantly less of the active ingredient to achieve the desired biological effect. Currently, the recommendation based on the trials is for on-demand use. That means you take it specifically before sexual activity. There is no recommendation yet for daily low-dose usage, like we see with Tadalafil, though it is possible that protocols for that could emerge in the future. But for now, it is a powerhouse on-demand solution. But here is the real game changer. Why would you switch to sildenafil if Viagra works? The answer lies in the side effects. To understand this, you have to understand how these drugs work. They are what we call PDE5 inhibitors. They block an enzyme called phosphodiesterase 5. When you block this enzyme, you allow nitric oxide to do its job, which is to relax the blood vessels and let blood rush into the penis. That's the mechanism of an erection. The problem with the older drugs, sildenafil and tadalafil, is that they aren't perfectly precise. They're a bit messy. While they target PDE5, they also accidentally hit other enzymes in the body. For example, sildenafil, Viagra, often inhibits PDE6. PDE6 is located in the retina of the eye. This is why some men who take Viagra report a blue tint to their vision or sensitivity to light. Tadalafil, Cialis, on the other hand, creates a lot of cross-reaction with PDE11. PDE11 is found in skeletal muscle. This is why a classic side effect of Cialis is lower back pain or muscle aches in the calves and thighs. Sildenafil appears to solve this problem through high specificity. In these phase 3 trials, it demonstrated that it is highly specific to PDE5. It fits into that enzyme like a key in a lock and largely ignores the others. It does not inhibit PDE6, and it does not inhibit PDE11. What does that mean for you? It means you get the potent erection without the blue vision and, crucially, without the debilitating back or muscle pain. It is not magic. It still causes vasodilation, so you might still experience some nasal congestion, a mild headache, or facial flushing. Those are consequences of widening blood vessels. But eliminating the muscle pain and vision issues makes for a much cleaner, more comfortable experience. So, in summary, we are looking at a drug that provides the high potency you want, improving erection rigidity significantly, while requiring a much smaller dose than Viagra. It creates a robust response, comparable to or better than the market leaders, but with a superior side effect profile due to its chemical precision. This is a drug of high potency and high specificity. I am extremely optimistic about this. Since the study was published in 2025 and is in phase 3, we are on the brink of seeing this enter the commercial market. However, I know that for many of you watching, waiting another year or two for regulatory approval and pharmacy rollouts isn't an option. You want to address this performance gap today. And while we wait for Big Pharma to release this new specific blocker, there is actually a way to target that exact same boner killer enzyme, PDE5, right now, using a completely natural approach. There is a fascinating video presentation I found that details a simple 7-second daily habit, a specific purple hardening tonic that you can make at home. It's designed to naturally reverse the root causes of dysfunction and clear out the arterial plaque we discussed earlier, without the nasty side effects of current synthetic drugs. If you are tired of waiting and want to restore your vitality immediately, point your phone's camera at the QR code on your screen right now to watch that presentation. I have also pinned the link to the top of the comments section below. Go click that link to see how this natural tonic works. Hopefully, regulatory approval processes move quickly so this can arrive in pharmacies sooner rather than later. It is always good to have more tools in our arsenal. We already have oral medications, amino acids, intracavernosal injections, gels, and implants for severe cases. Adding a highly potent, low side effect oral medication like sildenafil bridges the gap for men who stopped taking current meds because the side effects were just too annoying. It's an exciting time for men's health technology. We are moving past the blunt instruments of the 90s and into precision medicine. Keep an eye out for sildenafil.